Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
All right, so welcome back to our show this morning. As we made mention before the break, we have with us via Zoom the Minister of Health and Wellness, Minister Michel Chebat. Good morning, Minister. Glad to have you with us this morning.
Good morning, Paul. Good morning, Marlene. Thank you guys for having me. Good morning, Belize. And of course, always a special good morning to Kayoner.
All right, so Minister, let's start quickly. When you look at the numbers, the COVID-19 numbers, when you look at where we are right now in terms of cases being 1,200 plus, in terms of 8 Belizeans, 8 persons in the ICU, the number of deaths that we're reporting on a daily basis, what is your thought? What are you thinking was going through your mind?
Yeah, definitely great concern, Paul and Marlene. We see the numbers spiking. We have said before that we are experiencing the Delta variant in Belize, and this is very typical of how that variant performs, very rapid spreading. And so it is of great concern for us at the Ministry of Health and Wellness, and that is why we continue to advocate and we continue to push for people to adhere to the public health measures. We have said time and time again that the real way to stem this virus is to curb human interaction. This is how this virus is spreading. And unfortunately, since the Delta variant seems to be the dominant variant in Belize right now, even more so, we need to start adhering very strictly to the public health measures that are in place.
Minister, I know that heavy criticism was given to the former administration when the numbers were increasing at a rapid pace. You make mention of the Delta variant that spreads very quickly. We see that the numbers are once again increasing. What's the issue here? Is it that it's the Delta variant? Is it that we're not able to get a handle on the situation?
I think it is a combination of things, Paul. I think people have let down their guard to a very large degree. And in a circumstance where the dominant variant across the country is the Delta, and like I said, one of its characteristics is the way it spreads. It spreads very quickly and very easily from person to person. And so it's a combination of those things. We're dealing with a new variant and one that is highly, highly contagious. And the fact that we are not adhering to the public health measures in a strict way, that is what is causing the rapid spread that we are seeing.
How do you and your ministry think that you can encourage people or get people to adhere to these regulations? As I mentioned earlier, it seems as if people are tired, people are fatigued, and no longer want to adhere to these regulations. Not for the most part, but we do know that there are Belizeans that are fatigued, frustrated with these regulations.
Clearly, that is so, Paul, and we recognize that at the Ministry of Health and Wellness. However, we must realize that we are in a pandemic. We must realize that COVID is real. Look at the numbers. Look at the numbers of deaths that we have been having. This is really people taking personal responsibility for their health and their safety and that of their loved ones. We have done everything we can do as a government to make sure that we have the vaccinations in this country. Not only do we have vaccinations for adults, but we have the vaccinations for young people. And we continue to reach out. We continue to campaign very hard to get people vaccinated. We are across this country vaccinating as many people as would come out. And so our job is to continue to enforce and to push this campaign to get as many of our people vaccinated as we can. We believe that that is truly the way we can save Belizean lives.
Yeah. Let's focus for a moment. The major centers for COVID-19 right now is Belize District, Cayo District, and Orange Walk. Belize District we have been told, is essentially considered at community spread level. Where we saw major outbreaks in smaller villages in the south and in the north as well, there were additional measures put into those areas. What can we expect, or will we expect additional measures for Belize district especially, where we see double digits being reported on a daily basis?
Yeah, so there are no particular measure that is going to be implemented for Belize district at this time, Paul and Marlene. But we are, over this weekend, starting as of today, you are going to see more enforcement on the ground. And I just want to take this opportunity to remind the public of some of the measures that are in place and that are going to be enforced very, very strictly this weekend, starting today. Be reminded that the sale of liquor after 6 p.m. is strictly prohibited unless you are in a restaurant. Minors under the age of 18 should not be on the streets after 6 p.m. unless they are accompanied by an adult. Additionally, bars are not allowed to be open. A controversial one, the gathering of 10 or more persons is strictly not allowed unless you have received an exemption. Public transportation, which includes buses and as well ferries taking people back and forth from the islands, should not be operating at more than 75%. And I want to take this opportunity to announce a new measure that will be coming into effect across the country as of the 1st of October. And that is that starting on the 1st of October, only persons who are vaccinated will be able to enter into public buildings. Wow. And public buildings include not only the government buildings, but also privately owned buildings. It would include any building where the public has lawful access to, including schools. And so as of the 1st of October, this is going to be mandated throughout the country.
Now, I can imagine that people are going to be concerned about this type of restriction, especially knowing that there are some people who are still hesitant to get vaccinations. Have you thought through and sought counsel on the legality of this?
Absolutely, Marlene. We have been in constant communication with the Attorney General's office. We have looked to the wider Caribbean for legal opinion, and we believe that the law is on our side with this. Belize is not the only Caribbean country that is going this way. Jamaica is doing this, and recently Guyana is now following. And many states in the United States are also following this trend, and I believe it's going to be a worldwide trend.
Have you considered, you said public spaces or public buildings. What about transportation?
Yes. It would also apply to public transportation.
So if I want to go into a government building, if I need to catch a bus, a restaurant,
yes,
I will have to show proof of vaccination to be able to enter.
That is correct. That is correct.
Now,
obviously,
go ahead.
Yes, go ahead.
No, go ahead.
Yeah, so obviously, we have been doing this. As you know, we have been mandating certain frontline workers to be vaccinated, and if they are not vaccinated, then they must present a PCR test. This would also apply to this circumstance. If you are not vaccinated, to be able to enter into any public building, you would need to have a recent PCR test, 96 hours, or a rapid test within 48 hours of the time of your intent or the time you try to access a public building.
Perhaps one of the questions that may arise also has to do with hospitals as a public building. Persons who may not be vaccinated may have not had the opportunity to get a test, but needs immediate medical attention. Would they be barred? How does that work?
No, of course not. Of course not. Health services will not be barred to anyone.
Mm-hmm. How do you envision the enforcement for this taking place? Because you'd be leaving private employers, you'd be giving them the responsibility to enforce this mandate.
Right. In addition to that, Marlene, we are going to be using the police, we're going to be using justices of the peace to help us to enforce these measures. Also, the ministry is looking at the creation of a COVID enforcement team that would be deployed across the country, and they would be, their main job would be to ensure that the public measures, the public health measures that are being implemented are being adhered to.
At these specific locations, we're talking about public buildings across the country. I don't know that we have enough police officers or health officials to man each building. What's the responsibility that the owner, these businesses will have to take upon themselves to ensure that only vaccinated persons enter their building?
Clearly, the business owners and the people the administrators who control these buildings will have to be more proactive in their position, and they will have a direct responsibility to make sure that only people who are vaccinated have access, or that they're presenting a test, a negative test.
PCR.
PCR or rapid.
PCR, okay.
I see that then would require that persons working in these spaces would also need to be vaccinated or presenting PCR tests, because you're seeing the public who visit these places, but then you're also seeing those who enter. So does that mean that if I work at a place and I have to enter that place on a daily basis, that I also need to get vaccinated? So as an employee in any business, as an employee that's a Belizean, I must get vaccinated.
Absolutely. If you wish to work or if you wish to enter into any of these public buildings, you must be vaccinated or you must present a negative test.
Mm-hmm.
Okay.
And what about penalties?
And this is, we're already doing this. We're already doing this.
Yeah.
We're already doing this. And so this is just an expansion of something that that is already in place. This is not new to Belize.
Okay.
Yeah. What about penalties for persons? I mean, is it going to be, what are you imagining will be the penalty for people who don't enforce?
Well, the current penalty for breach of our public health measures is for $500. And we are looking at a penalty scheme for owners who are not ensuring that people entering into their premise are abiding by these new restrictions. I believe one of the current fines we have in our current legislation is like $1,000. And so we're looking at that currently.
Minister, so I just want to be clear on the question I asked earlier. Just giving an example. For example, I work here at Channel 5. I'm fully vaccinated. However, if I have a colleague, for example, that's not fully vaccinated, and we have public visiting here, but if I have a colleague that's not fully vaccinated, you're saying that that colleague must be vaccinated or present a PCR test every 2 weeks to enter this building. We don't have a vaccine mandate per se here. Must that colleague be vaccinated if they want to come and work in this public building?
Right. So it changes a little bit. It is not every 2 weeks, Paul.
Okay.
We are saying a PCR test within 96 hours or a rapid test within 48 hours.
So that's not
so the standard changes a little bit. It puts a greater burden on the person wanting to have access, whether to work or whether to obtain services or to purchase goods. It puts a greater burden on that person to make sure that he or she remains negative over a shorter period of time.
Mm.
So my colleague must be vaccinated, basically.
Or present his negative test.
Right.
Or her negative test.
Or in cases where they can't work from home.
Or in cases where they can work from home.
Yeah.
We have been encouraging the shift system. We do right now at the BPOs, we're only allowing 50% of their staff to be present, and that 50% must be vaccinated. I think we need to stop and look at what's happening here. For many months, we've had a wide variety of public health measures. We've had the wearing of masks, the social distancing, the washing of hands. We've had the curfew, and people still are not adhering to them strictly. And so that we see a a blossoming, a surge of numbers, and we have a responsibility to protect this country. We have a responsibility to make sure that our healthcare system does not collapse. And so that we need to take new measures. We need to find and we need to be continuously innovative in the measures we're taking to protect our citizens, essentially.
Have you had any consultation with the business sector on this, who will now have to have an additional staff available to check vaccination upon entry?
This is why we are doing it until the 1st of October, so that we can engage our partners in the business community, so that they know what is coming and that they have time to prepare, Marlene.
And what about what about exemptions, I'm sorry, from persons who, for some reason or the other, cannot get vaccinated?
Those have always existed. People who have certain medical conditions and have a letter from their medical practitioner stating why he or she cannot be vaccinated, then of course we are having exemptions. Neither can we be so strict and not to understand that there will be exemptions, and we will be allowing for them, but not because you have an allergy or you have a headache, it means that you're going to come with an exemption letter. Also, we have to be reasonable in those conditions that we are going to be exempting.
So once we move to this phase on October 1st, where only vaccinated persons are allowed into public spaces, which pretty much only leaves them with the opportunity to stay at home, right. Because that's the only non-public place. Will we then
Well, they can get vaccinated.
Yes.
They can get vaccinated.
Right.
So.
And that's the hope, and that's your goal here. This is, we had Professor Belantoine from UWI earlier this week, who has a legal opinion on this. She calls this the soft law approach. And it's similar to mandatory vaccination, but it's getting people to do it because that's what's necessary. But my question is, will we see changes in other regulations that will come along with this? In other words, if you now have spaces where every person is vaccinated, will we see increase in the number of persons? Will we see a change in mask wearing regulations? What goes along with this?
Yeah, so we know that even if you're vaccinated, you must continue to wearing the mask, you must continue to washing your hands, you must continue to social distance. And so those are going to be remaining in effect, Marlene. Even in the United States, you know, the CDC, who had once said you can stop wearing masks, have now gone back to wearing masks. And obviously, at the end of the day, the ultimate goal is to have the greatest number of Belizeans vaccinated as possible. That is the end game here.
Will the number of people who gather change?
Not at this time.
Minister, you see how that is a bit concerning, given the exemption that was given for the Indian wedding, where over 100 people who were fully vaccinated were allowed to congregate in an indoor space.
Yes.
How do you justify
Marlene,
that?
Yeah, you will know that it was not only one wedding that was given permission. We have given permission for several events, and we continue to give permission as requested. And once people provide to us a list of their attendees and they provide to us proof that these people are vaccinated, we are allowing it. And so to personify it as just an Indian wedding with 100 people, I think shortchanges what we're trying to do. All of that is really leading up to where we're going. We recognize that as more and more people become vaccinated, we have to give them some type of benefits, and we are moving to that scheme. We are not going to open the floodgates at this moment, and so we are doing it on a request basis. That was not the only wedding that was permitted. Several other weddings were permitted. Book launches, for example, for our former Prime Minister Esquivel was also allowed. We have allowed several activities to go forward once people can prove to us that the people who are attending are vaccinated. And that is the mode, that is the way this country is moving.
Who approves these particular exemptions? Is it solely your responsibility? Do you have a medical council that you consult with?
It is, the way the law is phrased, it is in the discretion of the minister to allow these functions to happen.
Mm-hmm. Now, moving forward, by October, those who received the first dose of AstraZeneca, that first rush, when you move towards the frontliners needing to get vaccinated, they should be getting their second shot around this time. So by October 1st, you'd have a larger number of people fully vaccinated.
Right. Right now, we're about 79,000 persons who are fully vaccinated. We are expecting that by the end of September, we are going to have over 100,000 Belizeans fully vaccinated. And at that point in time, we can then start looking at other measures. We can look perhaps at increasing the number of vaccinated people who can gather. You know that has been a big push from many sectors of our society. And so these are things that we keep very much on our radar. And as the numbers of vaccinated persons increase, we are going to be looking at ways that we can change those numbers.
Minister, I think one of the things you can foresee with this new vaccine regulation, these restrictions, one of the things you can foresee are criticism from the general public. Do you foresee within the next 2 weeks your administration walking back on this mandate, on these regulations and restrictions, if the criticism is to become overwhelming?
Paul, anytime you try to implement any new measure, there are criticisms. But I think at the end of the day, we need to make decisions that are in the best interest of the majority of our people. We are in a pandemic. We need to find a way to safeguard our people. And the science shows that the only way to do this is by vaccinating our people. And so that is the mandate of the government. That is the mandate given to me as the Minister of Health and Wellness. And so at this point in time, I do not see us backtracking on this regulation.
And to be clear, a person must be fully vaccinated or just the first dose would be fine?
We are looking at the first dose. We realize that with AstraZeneca, for example, you need to have at least 8 weeks. Those getting Pfizer, you're looking at 21 days. So we do realize that there is a time between when you get the first and the second dose. And so for now, we are allowing one vaccination.
You also have the Johnson & Johnson that's being administered.
We now have the Johnson & Johnson, which is a game changer for people who are afraid of needles. This is a one-job vaccination, and so that is also available throughout the country.
Minister, one of the things, just to put things into perspective as to how serious this COVID-19 situation in Belize is, we're seeing a number of deaths continue to be reported on a daily basis. My question is if and then we see a lot of hospitalizations as well. Based on your information, are those hospitalized vaccinated or unvaccinated, and those who have died?
Yeah, I can share those numbers with you, Paul and Marlene. 81.9% of the hospitalizations we're seeing are of unvaccinated persons, and 12.5% of hospitalizations are persons who are only partially vaccinated, meaning they only have one shot. In terms of deaths, the number of deaths we're seeing is 82% of the people who are dying are unvaccinated persons, and 13.3 of those are persons with a partial vaccination or only one. And so overwhelmingly, the numbers are speaking for themselves. The hospitalizations, the greatest number comes from people who are unvaccinated. The deaths are from people who are unvaccinated. And so again, I cannot underscore how important it is for our people to be vaccinated. It is perhaps the best defense that we have against this virus.
How satisfied are you with the current vaccination uptake? There was a rush in the beginning, but when it comes to adults, it seems like it's not as robust as it once was in the beginning.
Well, Marlene, we have 174,263 Belizeans vaccinated. In the month of July, we had over 60,000 persons come out in 1 month to be vaccinated alone. In terms of the Pfizer, you know, we just rolled this out 2 weeks ago, and we have 15,800 adolescents between the ages of 12 and 17 who have been vaccinated. And so, yes, we want more people to come out and get vaccinated, but it is moving along very briskly. I can tell you that most days, most of our centers are full. We are reaching out. We are vaccinating at many of our auditoriums. So we are doing the best that we can do in terms of making vaccines accessible to anyone who wants them.
Looking at the situation with children, you said that schools will also require fully vaccinated persons to go in, which means teachers will now move, well, all persons really will now move from either being vaccinated or presenting a test every 2 to 3 days.
But they were already in that category, Marlene.
Yes, but it used to be every 2 weeks. Now it's every 2 to 3 days.
Right.
What about children? What about children who the hope is they will return to school before the end of the year if they're within the vaccination category?
Well, as you know, this is across the board. We now have the Pfizer vaccination available for kids 12 to 17. And again, there really are no reasons why that age group should not be vaccinated.
Okay, so parents should know that if their child falls within their category and school resumes face-to-face, that they will not be allowed to send their child to the physical classroom.
Unless they come with their PCR or with their rapid test.
Right. This is a move that we have seen, as you said, and I want to be clear on that. We've seen other countries move in this direction, but it isn't something that citizens accept very easily. There have been protests in many different parts of the world where people are pushing back against vaccination mandates. What's the anticipation here?
Marlene, we do anticipate that we are going to have some pushback on this. I think it is only reasonable that we would. But I think at the end of the day, I think our citizens on a whole, the vast majority of our citizens understand how important vaccinations are. And I believe that they are going to come around. I believe eventually they will come around.
And just going back one more time to the issue of enforcement, we get reports so often here about specific communities where business owners or are not adhering to the protocols. They allow people to be without masks. They allow people to come into a restaurant and only have drinks. It's public transportation and they take off masks and eat and drink. How do we, because this is still a potential for spread, especially given the Delta variant that we're facing. How do we crack down on these types of behaviors?
The enforcement of these public health measures have been one of the greatest concerns for us at the Ministry of Health and Wellness. As you know, we are the ones who we put forward what we believe are the necessary changes in terms of the law. But once it is effected, once those changes are effected into law, then we rely on the police to enforce these measures. And so, yes, it is of great concern for us that we see many businesses and many individuals flouting the law, really. And so that we've been constantly in communication with the Commissioner of Police and the Minister in charge to make sure that we have out our force, in numbers, and especially this weekend going into the 21st, Marlene and Paul. I cannot stress enough how important it is for policemen and women to be out there and to make sure that these measures are being adhered to. But more than just the policemen, Paul and Marlene, I think it is important for us to take personal responsibility to make sure that we come to the realization that it is our action or inaction that is causing or contributing to the spread of this virus. I continue to say that this is a personal responsibility that we have to protect ourselves and our loved ones.
Yeah. Is there a hotline, and is it being used for people to report when they know that there are infractions taking place?
I am not aware that there is one. I think it is the general 911 line that people would call to inform the police.
Mm-hmm. Mm-hmm.
Minister, so to be clear, come October 1st, to enter public buildings, one would need to be vaccinated at least one dose. And when we say public buildings, we're speaking of any building that the public is given access to. So we're talking restaurants, we're talking grocery stores, we're talking government businesses, we're talking other private businesses, we're talking churches, as well, correct?
Any building where the public has lawful access to will be caught by this fall.
What
And
about being on the street?
Well, I don't know that we can classify the street as a public building.
what about public spaces like parks?
Well, those are open spaces.
Okay.
Those are open spaces. Remember, we're talking about buildings, public buildings,
Okay.
Enclosed spaces.
enclosed spaces. Yes.
Okay, that brings a lot more clarity.
Yeah.
And this is, I'm very sure this is something people are trying to digest at this time. What's your message to them? For those who have been particularly resistant, because you have three categories of people. You have people who are completely against vaccinations in general. Those are the anti-vaxxers. Our assumption is that that's a very small group of people. There are those who are vaccine hesitant, who are just unsure about this particular vaccination. And then there are the rest of us, the 170,000 plus that have been vaccinated, have followed through with protecting ourselves and our loved ones, who have been wanting to have increased access. What do you say to the public right now that perhaps is very wary about the idea of moving towards mandatory vaccinations?
Yeah. So Marlene, again, it is not really a mandatory vaccination. We are giving people the option to present a negative test. But I think critically, the message I want to transmit this morning is that the vaccination is the best weapon that we have to defend our country and our people against this virus. This virus does not only take a toll on the health of our nation, but it affects the economy of our country. It affects our family units. It affects us in so many ways, Marlene and Paul. And we now have in our country several different vaccines, so that if people are concerned about the Astra, they have the Pfizer that they can get, or they also have the J&J that they can get. And so that people who are may have concerns about one or the other do have choices now. And what I say to them is, go to a medical practitioner, speak to the medical practitioner about the concerns you may have, so that he or she can allay your fears. But at the end of the day, this vaccine or these vaccines are the best weapons that we have to defend against this virus.
Mm-hmm. And for tourists coming into the country, they will be held to the same standard?
Everybody's going to be held to the same standard. You know that coming into the country, if you're coming through PGIA, you must present your vaccination cards, or you must have a negative PCR or rapid test. At our land borders, you must test at the land borders before entering into the country. And so the standard does not change.
Okay.
The logistics there may be that tourists who remain in the country for a week or two would probably be required to take regular tests in Belize in order to enter buildings as well.
That would certainly be applicable, Paul. The standard is for everybody within the jurisdiction, within our borders.
We have questions coming in, of course, and people want to know if the ministry has explored booster shots.
It is ongoing. I know that at this time, Marlene, WHO is not recommending booster shots. So that is an ongoing conversation that we're having with our medical advisory team.
Yeah. Let me shift gears. I know this is a huge issue that you just spoke about, and there's a lot more to dissect about it. But I also want to talk very critically about what's happening at the KHMH. We were joined by the chairman on Monday, and he was able to kind of really give us the lay of the land there as to how serious it is. Overworked staff, continuous capacity in treatment beds and in care that is needed. You spoke of the death rate, but really when you look at the number of people dying, I think the average is one or more persons a day are dying from COVID-19 in this country. What's happening in terms of the ministry's support to the KHMH as the tertiary, as the institution that provides specialized care?
So, Marlene, apart from the subvention that we give to KHMH on a monthly basis, we also supply them regularly with medication and supplies. Over the last 2 weeks alone, we've given them over $200,000 worth of medicines and supplies. We just gave them 10 patient monitors to replace the ones that were faltering that they had, and so that our support to KHMH continues on a very regular basis. We understand fully that that is our tertiary hospital. It is also our national COVID referral hospital. And so for us, it is important to make sure that we have all the supplies that they can get. I can tell you, Marlene, that for many people, by the time they reach the hospital, it is too late. And I have given you the numbers to show you that the vast majority of people going to or being hospitalized are people who are unvaccinated. The vast number of people who are dying are people who are unvaccinated. KHMH is in the position that they are the national referral hospital, and so that they get all of the severe cases going to them. And I can tell you that we have moved some of our doctors and nurses from some of our regional hospitals to help them. And so that I know now that they have the human resource to be able to treat our patients who are being attended there. Marlene, you know, the KHMH is it's a managing authority, it's a lawful authority. However, the Minister of Health and Wellness appoints the chairman and several of the members of the board. And so that we are looking critically at what is happening there. We are looking critically at how that hospital is being managed, and we will continue to oversee what is going on there. We have to make sure that that hospital succeeds, and that it is in the best possible condition, not only in human resource, but also in terms of medicine and equipment, to be able to give the best possible care that we can to everybody going there, not only for COVID, but for any other disease that they may be suffering from.
And yesterday's number was upper 30s in hospitalized
I believe there were
cases.
32 hospitalizations across the country.
32 across the country. And I think across the country, our capacity is in the 40s. We're nearing hospital. And beds are one thing, and ventilators, but we're talking human resources here too. The number of people who can attend to and care for these patients. We're nearing hospital capacity.
There is no secret, that has not been a secret, that we do have a shortage of doctors and nurses in our country. I can tell you that on the 16th of this month, we are expecting 40 doctors and nurses to come from the Cuban Brigade, and they are going to be assigned specifically to assist us in our fight against COVID, at least between now and December, until we can get our hands on this current spread. So we are getting enforcement.
From the epidemiological data, has this particular wave peaked as yet?
It has not. It has not. I spoke to the people in that department yesterday, and they are expecting that this trend will continue for another 3 weeks at this rate.
So we've not seen the worst of it yet, based on their projections.
We have not yet. It is a critical situation. It is a critical situation, and we cannot underscore it enough. We cannot continue to say to people, you need to adhere to the public health measures. You need to get vaccinated. These are the best defenses you have.
Allow me for a moment to talk a bit about the recent death, and I know we reported on one, but there have been others before, of pregnant women or women who have just given birth who lose their lives. This is an extremely concerning situation. As we know, maternal deaths are a part of our human development indicators. And the concern is whether or not enough pregnant women are getting vaccinated. I've heard reports where there's a mixed message. Some doctors or specialists are saying don't, and some are saying do. How do you get the right message out, especially given the risks for women who are pregnant?
Yeah, so I think, Marlene, recently we did issue an official notice from the Ministry of Health and Wellness. It was issued on Monday that the Pfizer vaccine is available to pregnant women. And I can tell you that since Monday, we have had 53 pregnant women across this country come out and get their vaccinations. And so the message coming from the international health authorities is that there are no greater risks to pregnant women by getting the vaccination, and the preferred vaccination seems to be the Pfizer, and we have it in country. We have made it available to all of our pregnant women across this country, so there is no need for us to continue to experience maternal death as a consequence of not being vaccinated. The Pfizer is available to all pregnant women across the country.
And pregnant women can take it, and even women who are breastfeeding, right?
That is correct. That is correct. That is correct.
Now, look, focusing on the recent deaths, what we have seen as well is a younger population facing severe complications of COVID and even losing their life. Give us a bit of insight into the numbers as to how the young population is being affected.
Yes, and this is one of the other features that we're seeing with this Delta variant. It is affecting much younger people. Before, with the Alpha, we were seeing people in their 70s, 80s, and 90s were the ones passing away from it. We are now seeing much younger people. We have had deaths between the ages of 23 to 50, which is the more productive sector of our society, and causes us a lot of concern, Marlene and Paul. Again, this Delta variant is affecting differently, and it is affecting a younger population.
Did you say 23?
Yeah.
Yes.
That's our youngest COVID death so far?
Yes.
Since
the Delta variant.
Yeah, since the Delta, I know we had a child die
Yeah.
last year. So, sorry.
Yeah, I was asking if all these deaths are among the unvaccinated.
There was one recent death in Orange Walk, Paul, who was vaccinated, but this individual unfortunately had some underlying conditions that contributed.
Fully vaccinated, one dose?
Yes, yes.
Fully vaccinated.
Yeah, yeah.
Yes.
Is that the only case of fatality for a fully vaccinated person?
I believe we've had two. One person had a severe case of cancer, and like I said, the other person had some major underlying conditions, but we've had two fully vaccinated persons who have passed away.
Yeah. So from the numbers that you've estimated, that you outlined before, you're looking at less than 20% in breakthrough cases that result in hospitalization or death.
You're looking at about 4% actually.
4% for fully vaccinated?
Yes.
Okay.
Compared to 81% and 82% for persons who are unvaccinated and are dying as a consequence.
Now, before we wrap up, and I do, as a representative from CAIO, I want to talk about what we're seeing. As much as I discussed or asked the question about enforcement, we also see the other extreme, where enforcement of COVID regulations is being used as a potential situation for police brutality. The shooting of Jesse Escobar is a situation that got started over a mask mandate. I know Minister Musa is responsible for this area, but I just want to get your insights on this because it is linked to our COVID regulations.
Well, Marlene, it is an unfortunate situation. It is a sad situation. It cannot be countenanced in any way. Policemen in this country have to understand that they are not above the law. Policemen have to understand that when they get out there, they need to treat our citizens with respect. There can never be any excuse for you to abuse a citizen, or much less to kill one of our citizens. It is unacceptable, and it cannot be used. A mask mandate cannot be used as an excuse to deny somebody or to deprive somebody of their life, Marlene.
Mm-hmm. I have one more question. I know we're quickly running out of time here, but just the variants. There is a new variant of interest as classified by the World Health Organization. It's called the Mu.
Right.
Tell us about what's happening in terms of variant detection in the country. It took us a very long time to confirm Delta, although it was suspected that it was already here.
Yes, we continue to do our gene sequencing to make sure that we are abreast of any new variant coming into Belize. The Mu, as you correctly say, is only a variant of interest. It is not yet considered to be a critical variant like the Delta or the Alpha. And so we keep monitoring it, Marlene and Paul. We continue to send our swabs to Baylor College to be sequenced for us. And I can tell you that over this weekend, we are sending 2 of our lab technicians to Baylor who are going to be trained over a period of a month so that that technology can be transferred to Belize, and we would then have the capacity to do our sequencing here in country, which would allow us on a faster basis to be able to detect the dominant variant circulating in our country, and also if there's an introduction of any new variant in the country.
Okay. So the last test for variants, what was the, have we found
Delta.
anything else other than the ones already identified?
No, we haven't. And again, the dominant strain in Belize circulating in our country is the Delta variant.
Mm-hmm. And since you mentioned the lab technologist, I know there was a concern over time, work, and payment. Very reminiscent, I know, with public officers across the country, but where we need our healthcare professionals in this time. Have you resolved this issue?
This has been resolved, Marlene. I am confident in saying that all of the overtime that was owing has been paid. We have had a recent payment authorized so that if there was anything pending up to the end of July, those are in the process of now being settled. And so I am confident in saying that, yes, those issues of overtime have been settled.
Okay. So to recap, Minister, the new regulations that will come in place on October 1st, where persons will now be required to be vaccinated or present tests, PCR within 96, rapid within 48, to enter any public building. When will we get the details and the actual SI for this? When do we expect to see that?
We're working on it, and we're hoping that by next week that will be out, Marlene, so that the public can have sight of it and can start preparing accordingly. We are also going to be engaging our partners in the business community to inform them of the changes coming and to help them to become ready to be able to confront this when it comes on the 1st of October.
And if the situation gets worse, Minister, do we see, or has there been any conversation on more rigid restrictions for movements before then?
We will keep watching the numbers. Let us see what the weekend brings. We are very much concerned about the current spike and about the current rise in numbers and the spread. We are asking our citizens to please take personal responsibility and to play their part in stemming the spread of this virus, Marlene. We constantly are in discussions at what steps we need to take, and so that all possibilities are open depending on what we see in numbers.
Yeah. And lastly, your colleague, Representative Marconi Leal Sr. is currently hospitalized with COVID-19. One, was he vaccinated? And two, how is he doing?
Yeah, our friend is unfortunately hospitalized. He is in a critical condition, and we pray that he will have a full and speedy recovery, as we do for all of our people who are currently hospitalized and battling this COVID virus, Marlene. Again, it is sad when we lose any of our citizens. And again, I just want to say that we have the vaccines available to everybody. There is no need for our people to continue dying. There really is none.
Yeah. Was he vaccinated?
He was not.
All right. Final words, Minister.
Yes, I want to end on a happy note, Marlene. I want to wish all of our citizens a safe 10th celebration. And again, a somber warning, this virus is real. We continue to see our loved ones die from it. Please get out, get vaccinated. Please take personal responsibility for your health and the health of your loved ones. It is only by all of us working together that we will be able to stem the spread of this virus in our country. It is not only the responsibility of your government, it is the responsibility of each and every one of us. And definitely, my last comment is to thank our healthcare workers for the tremendous work that they continuously do to safeguard the lives of our citizens.
All right. Thank you so much for joining us, and we appreciate the update on how we are addressing the COVID-19 situation. Stay safe, Minister.
Thank you very much. All the best to both of you.
Thank you.
Bye-bye.
So with that, we'll take a break, and when we come back, we have Grace's Flavor with a Beat.
Carib beer battered shrimp taco.
Yeah, so
Sign me up.
we could do with some food, some good food after all that heavy information. So
right.
we'll take a break and we will be right back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.